pen light and stethoscope. Hi, my name is Courtlyn Hale. I'm going to be your student nurse from Georgia Southern. Today I'm just here to do a general survey. I'm going to be assessing your musculoskeletal, cardiovascular, and respiratory systems along with your abdomen. I'm just going to start by providing some privacy, and I'm going to perform some hand hygiene really quick. Can I see your wristband? Can you tell me your first and last name?
Peyton Shonut.
And your date of birth?
3/19/2004.
All right, perfect. Now that you told me who you are, can you tell me where we are today?
The nursing building.
And can you tell me why we're here?
For checkoff.
And what day of the week it is?
Thursday.
Alrighty, so now that you told me all four of those things, I can confirm that you are alert and oriented times 4. I can also tell that you are conscious. I do not see any signs of lethargy. You're alert and paying attention to the conversation. How are you feeling today?
Good.
And how's your mood? Or are you experiencing any pain or discomfort today?
No.
Alrighty, so based off your response to my questions, I can tell that your speech is articulated. I can also tell that you are hearing everything I'm saying, as I have not had to change the volume of my voice at all. So now I'm just gonna clean my stethoscope really quickly. Get it out. Just gonna clean the end piece. Alrighty. Now I'm just going to perform some safety checks. I'm going to make sure that the bed is lowered all the way, it is locked, both side rails are up, and your collar is right here if you need anything. I'm just going to start by assessing your head, face, neck, and eyes. So I'm just going to look at your eyes really quick. They are symmetric. I don't notice any signs of swelling or drainage. Now I'm just going to put the pen light into your face to look at the roundness of your pupils. Alrighty, so both of your pupils are round. Now I'm just going to be testing for reactiveness of the pupils. Alrighty. Both pupils were equally reactive. Now I'm just going to get you to look at my pen, and I'm going to get you to follow it as it comes closer to your face. Alright, perfect. So what I did was just tested for PERLA, which is pupils are equal, round, reactive to light and accommodation, and your pupils were all of those things. Now I'm just going to be looking at your face. Can I get you to smile for me and frown? Alrighty, so your face is symmetric. There's no signs of drooping on either side, and the facial movements were moved with ease. There's no slow reaction time. Now I'm just going to be palpating and auscultating your carotid artery bilaterally. Alright, perfect. So I did not hear any unusual sounds such as bruise when I was listening. Now I'm just going to move on to your skin. Can you tell me your ethnicity?
White.
Alright, I can confirm that your skin color is congruent with your ethnicity. I'm just going to be feeling your skin now. So your temperature is equal bilaterally on both arms. It is warm. I do not notice any variations besides the freckles on your chest. Other than that, the skin color is consistent throughout the entire body. Now I'm just going to do your capillary refill. Now I'm just going to be doing your pulses. I'm going to start up here, and I'm going to do them bilaterally. I'm going to do your brachial, and that was even, regular, and +2. Now I'm going to do your radial. That was even, regular, and +2. Now I'm going to be doing your posterior tibial pulse. That was even, regular, and +2. Now I'm going to be doing your dorsalis pedis pulse. That one is even, regular, and +2 as well. Now I'm going to be doing your capillary refill. Alrighty. Now your hands. Alrighty, so your capillary refill time was less than 3 seconds. You're getting good circulation to both of those extremities. As I'm looking at your body, I'm not noticing any signs of edema whatsoever. Now we're going to move into the musculoskeletal. Are you experiencing any numbness or tingling today?
No.
And as you're walking in the room, I was looking at your range of motion. I could tell that you were moving all of your, while you were moving, it was without difficulty ×4, and your gait was steady and smooth. So now I'm just going to move into the respiratory assessment. looking at you breathing, it is unlabored and effortless, and your chest wall shape, I do not notice any abnormalities. You're also not using any accessory muscles to breathe, such as the trapezius, scalene, and sternomastoid. Now I'm just going to get you to sit up for me, and I'm going to be looking at your chest wall symmetry. Alrighty, take a deep breath for me. Alrighty, so your breathing is symmetric. If you'll just stay facing that way, now I'm going to be auscultating a couple of your lung sounds posteriorly. If you'll just take a deep breath every time I place my stethoscope down. Alright, you can sit back down for me, or lay back down. So I did not hear any signs of any adventitious sounds. If I did, it would be wheezing, which sounds like a high-pitched musical note, crackles, which are coarse and low-pitched, bronchi, which is a snoring sound, and pleural friction rub, which sounds like leather rubbing together. If I were going to be assessing your anterior lung sound, I would listen to the bronchial, which is over the larynx and trachea, and that's more of a high-pitched sound. And then your bronchiovesicular, which is going to be over your sternum, and that's going to be more of a moderate pitch sound. And then your vesicular, which is over the entire lung cavity, and that's going to be a low pitch sound. So now I'm just going to move into assessing your cardiovascular system. So I'll just get you to lay down for me. And I'm going to start with auscultating a couple of your pulses. I'm going to start with your aortic, which is going to be on the second intercostal space on your right side. Now I'm going to go to the pulmonic, which is in the second intercostal space on your left side. Now I'm going to go to the tricuspid, which is in the fourth intercostal space on your left side. And lastly, your mitral, which is in the fifth intercostal space on your left side. Alright, perfect. So I did not hear any signs of any extra sounds, such as the S3 and the S4. I did not hear any murmurs. I did hear the S1 ladder at the apex and the S2 ladder at the base. So now I'm just going to move into your assessment of your abdominal cavity. Sorry. I'm going to make sure the head of the bed is at 30 degrees, and now I'm going to come over to this side of the bed. I'm going to put this down really quick. Alrighty, so just looking at the skin color, I do not notice any variations. It's consistent and congruent with your ethnicity. I do not notice any signs of any piercings, striae, or scars. I'm going to get you to flex your abdomen for me. Alrighty, you can release that. I once again do not notice any signs of piercings or any hernias. Now I'm just going to be looking at the contour. The contour is flat. Now I'm just going to be auscultating all four quadrants of your bowel. I'm going to be starting in the right lower quadrant. Alrighty, I can confirm that bowel sounds were present in all four quadrants of the abdomen. Now I'm just going to be palpating it once again in all four quadrants, and I want you to tell me if you feel any tenderness. Alright, did you feel any tenderness?
No.
Alrighty, I did not notice any signs of guarding or rigidity. That'll conclude our assessment. Now I'm just going to perform some safety checks, make sure the bed is locked, it is lowered all the way. Your collet is right here and both side rails are up. Did you have any questions for me before I go?
No.